Hello, everyone. My name is Angela Williams,
Hi, everyone. My name is Taisha Scott.
and the health topic we chose was postpartum depression and mental health. Postpartum depression is a condition affecting many new mothers.
In this presentation, we will dive into this medical concern and how it should be approached as health educators. To start, we will discuss the goals and significance.
The goals of this presentation are the following: to increase awareness of postpartum depression, to identify effective interventions for managing PPD, and to explore AI tools and applications in predicting and managing PPD.
The next three goals are the following: improve early identification of postpartum depression through routine screening, ensuring access to resources and the support for women suffering from this condition, and to provide educational resources for postpartum mental health for healthcare providers.
So, what actually is postpartum depression? Postpartum mood disorders, which affect women within the first year after childbirth, are more severe than the typical baby blues. According to Carson et al., these disorders are caused by a combination of hormonal changes, genetic predispositions, and environmental factors. Symptoms include persistent sadness, low self esteem, sleep disturbances, anxiety, and difficulty bonding with the baby. These conditions can significantly impact a mother's mental health and well being, making it important to seek support if these symptoms arise.
Health disparities and mental health. The first one being socioeconomic status. This involves lower income individuals often face a greater stressor such as financial instability, lack of access to quality healthcare, and housing insecurity. Financial strain is also a way that can limit access to mental health. The next one is racial and ethnicity. Black, Hispanic, Native American, and other racial and ethnic minorities experience higher rates of postpartum depression, but are less likely to receive adequate mental health care compared to their white counterparts. The cultural stigma surrounding mental health, particularly in these communities, can also discourage individuals from seeking help. Discrimination and racism can also contribute to chronic stress, thus increasing the vulnerability of PPD. The next health disparity is maternal health and pregnancy complications. Women who experience complications during pregnancy and childbirth or the postpartum period may be more susceptible to PPD. Additionally, mothers who have had multiple miscarriages or stillbirths may experience higher rates of depression and experience anxiety during this postpartum period. The next is mental health history. Women who have had a history of mental health issues such as depression, anxiety, or prior PPD are at a higher risk of experiencing postpartum depression. Age and teenage mothers. Teen mothers are more likely to experience postpartum depression compared to their older mothers as they lack social support, have lower socioeconomic status, and face additional challenges related to parenting at a young age. The final health disparity is partner support. The presence or absence of a supportive partner and strong relationships can significantly affect mental health outcomes after childbirth. A lack of support from partners, family, or friends can increase feelings of isolation and hopelessness, both of which contribute to mental health challenges.
For our next topic, we will be talking about the methodology. Researchers used customized frameworks to address specified research goals. The studies analyzed factors influencing depression symptoms among mothers, considering variables like cultural influences, social support, and healthcare access. Through questionnaires or structured interviews, they also used survey-based research to gather information directly from participants. This specific approach involves asking mothers about their mental health symptoms, coping mechanisms, and access to mental health resources. The data gathered was then analyzed to identify patterns, correlations, or trends related to postpartum depression. Various databases were used, such as PubMed, PsycInfo, and Scopus. Common research terms included postpartum depression, mental health, maternal health, risk factors, and interventions.
Next, we will go into the significant findings regarding postpartum depression and mental health. Prevalence and awareness of postpartum depression. Stigma and access to support. The stigma surrounding mental health can prevent mothers from seeking treatment, particularly for PPD, which may be misinterpreted as a personal failing or weakness. Health education interventions can normalize discussions around PPD that can help reduce the stigma and encourage more individuals to seek timely support. The next finding was early detection and intervention, particularly routine screening and the role of AI technology. AI tools are also effective in predicting PPD risk, which could be incorporated into digital health education programs. Finally, education and community support and peer networks as it relates to mental health behavior change. Regarding education, educating new parents on self-care, resilience building, and mental health coping strategies can foster behavioral shifts that prevent PPD symptoms from escalating. Empowerment-focused health education encourages proactive mental health management, reducing the severity and duration of postpartum depression. Community support and peer networks also have shown to positively influence mental health outcomes for new mothers.
Continuing on with significant findings, studies suggest that PPD screening and treatment, though not always available, are crucial to reduce long-term healthcare costs by preventing severe depression. There's an implied economic benefit in early interventions, which may reduce the need for more intensive care later on. Government sources emphasize the economic need for widespread screening and treatment for PPD, as untreated depression can lead to increased healthcare expenses due to complications. Incorporating mental health care into maternal health services is suggested as a cost-effective strategy that can reduce long-term economic impacts on healthcare. Moving on to the emotional burden. Studies highlight a high emotional burden on both the affected individuals and the caretakers. Emotional impacts are seen through increased stress, anxiety, and strained family relationships. There's also evidence that certain interventions, such as blended therapeutic formats, are generally well received by participants, offering potential relief. Early detection and treatment are proven as vital for alleviating emotional stress for both affected mothers and their families.
This figure demonstrates the socio-demographics that were measured as the initial independent variable, which includes 4 indicators, i.e., age, group, educational background, working experience, and income household per month. According to the study listed below, socio-demographic variables played a significant role in establishing the relationship between the variables to postpartum women. It was concluded that food consumption among postpartum women has an interrelationship with body mass index.
In this second figure, the bar graph displays the prevalence of self-reported postpartum depressive symptoms by site, as reported in the 2018 Pregnancy Risk Assessment Monitoring System, also known as PRAMS. The graph illustrates the variation in percentages of postpartum depression symptoms across 31 different sites in the United States. The variation in prevalence across different states and territories may reflect regional differences in socioeconomic factors, healthcare access, support systems, and other environmental factors influencing postpartum mental health.
Next, we will go into AI tools and applications. In the 2015 article titled A Mobile Health Application to Predict Postpartum Depression Based on Machine Learning by Serrano et al., the authors focused on the use of artificial intelligence and machine learning tools to predict postpartum depression. Some of these included support vector machines, SVM, random forest, and decision trees. Support vector machines are a supervised machine learning algorithm used for classification and regression tasks. In this case, SVM was applied to classify women at risk of postpartum depression based on their health data, such as medical history, lifestyle, and psychological indicators. The second, random forest, it was one of the more accurate models in the study and played a key role in predicting the likelihood of postpartum depression. Finally, are decision trees. These are another type of supervised learning algorithm used for classification. Decision trees help model decisions and their possible consequences, including chances of depression based on various factors like social support and prior mental health issues. Some ethical concerns and biases. The three major ones are privacy and data security, algorithmic bias, and data bias. Regarding privacy and data security, the application processes sensitive personal and health data. There is a concern that this data might be misused or hacked, leading to violation of personal privacy. Data bias is a machine learning model which is only good as the data they are trained on. If the data used to train these algorithms is not representative of all demographics, such as age, race, and socioeconomic status, the predictions might be. Finally, algorithmic bias. Even if the data is diverse, the algorithms themselves can be inadvertently develop biases based on the way they are structured or how the training process is designed.
Now let's talk about the public health implications. Overall, it highlights the importance of early identification of postpartum depression to reduce its impact. Routine screening for PPD, such as through tools like the PHQ-9, should be integrated into both prenatal and postnatal care settings. Given the significant prevalence of PPD, the study suggests that more resources should be allocated towards mental health services, especially in communities and primary health settings. Interventions should also be tailored to fit the cultural context of the population being served. Home visits and interpersonal psychotherapy may need to be adjusted based on cultural norms and expectations.
Medical and clinical recommendations. So, what can we as health educators do regarding this medical concern? Interdisciplinary holistic care, awareness campaigns, and support systems. Regarding interdisciplinary collaboration, it is important to foster interdisciplinary collaboration between healthcare providers, including pediatricians, obstetricians, mental health professionals, community health partners, which all offer a comprehensive care for mothers suffering from postpartum depression. Awareness campaigns can empower mothers to seek help early and create a more supportive environment. Finally, support systems help implement and promote psychosocial support programs such as peer support groups, counseling, and educational resources that specifically address the emotional needs of new mothers. And thank you so much for listening, and we hope you consider our program.
Thank you.